Hi guys, it's Dr. Megan back with you again to talk with you about that first stage in digestion, which if you guys remember, we were talking about the mouth. So if you didn't catch the video before, just make sure you kind of hop in and look at it. It's only like 2 minutes, and it's going to kind of just describe to you what we're talking about here and why we're starting off with this mouth topic. So let me get over here. Let me share this screen real quick. And then we're going to look at, so there are really three different things that we're trying to accomplish first in the mouth. And that is going to be mastication, which is chewing, lubrication to help you swallow the food. And then some absorption actually takes place in the mouth as well. So this is why it's so incredibly important that we discuss this process, because the very first part of digestion is actually going to be in your mouth. And what is so fascinating to me about it is that so many people actually don't think about this process. So if you think about it, the process of the mouth, the chewing, is going to be to take that solid food and break it down into smaller chunks. Then you'll have this thing called saliva, which coats that food and then helps it make it easier to swallow, right? So then it can slide down the esophagus better and then get into the stomach and start doing the stomach actions. The other thing that most people don't understand is that a lot of absorption takes place in the mouth. So upwards of 90%, I think it's 80% of absorption of your carbohydrates actually start in your mouth. So carbohydrates are, like your fruits and some of your veggies and, the simple carbs too, like the breads and things like that. So we're really looking at, those three main functions. So think about this. If you don't have proper alignment of your teeth, this could create an issue, right? If you have what's called a lip or a tongue tie, this could potentially create an issue. Keep in mind, I'm going to have a specialist kind of come in and talk with you guys about what that means. It's called tethered oral tissue. And essentially, there's some imbalances that happen inside of the mouth, and those things can absolutely delay your ability for digestion and can affect like so many problems. Like there's so many different things going to happen from that. So stay tuned for that. We'll talk about it in a different section, but think about it. If you can't properly chew, so if your jaw is out of alignment and it's causing problems, well, that can create an issue. If your teeth aren't aligned well, right? This is why we do that orthodontic care, right? Not just because we want to have a pretty smile, but also because that's a proper, way to break down your foods. And then if we think about this from the other aspect, the sugars, the carbohydrates begin absorbing in your mouth. So for those of you, maybe we should make this like a little pop quiz. Why do you guys think that I love to use herbal tinctures? Right there. That's why I love to use herbal tinctures, because if you look at your herbs, the herbs that we prescribe to you, if you were to look at the bottle, because they're in a liquid form, they're actually in an alcohol solution. And alcohol is considered a carbohydrate or a sugar, and that's actually going to begin absorbing in your mouth. So even if I'm working with a patient, and several of you guys are, whose digestion is particularly stubborn, and I'm suspecting that you're not going to absorb your nutrients as well, if I can get you with an herbal tincture or something in a liquid form like that, I can actually start some absorption earlier on with you. And that is like fantastic news. So this is a huge thing. This is also why you need to be very cautious about what you're putting into your body and into your mouth. So for those of you who thought it was really cool back in the day to pop open the glow sticks and stuff and put them in their mouth, it's probably not the best idea now that there's a decent amount of absorption that happens in there, right? So very, very, very important. So the mouth is absolutely part of digestive process. This is such an important thing for you guys to have an understanding of. If you feel like you're having a struggle with an area like that, definitely talk with me about it at your next visit. But stay tuned, because our next topic, we will talk about the esophagus and what its function is. So type any questions or comments below, and I'm happy to assist you in any of those things. But otherwise, stay tuned for the next topic.